So here you can see that is the intervertebral disc. So the intervertebral disc that should be present between the two vertebra, adjacent vertebra, in this blue color here. So the intervertebral discs, these are the fibrocartilaginous disc which located between the bodies of the adjacent vertebra. So here in the another diagram again you can see this one. These are this one. So here again that is the shape of the intervertebral disc. So their shape of the intervertebral disc that correspond the vertebral bodies between which they are placed. The thickness of the intervertebral disc that varies from the different regions of the vertebral column. That is in the different part, and the thickness is different in the different vertebra. That is in cervical and the lumbar region, that is the discs are thickened in front than the behind, while into that the thoracic region they are uniform thickness. The discs are thinnest in the upper thoracic region and very much thickest into that the lumbar region. Then the structure of the intervertebral disc. So the intervertebral disc, it contribute near about the 1/5 part of the vertebral column, and the contribution it is greater in the cervical and the lumbar region than the thoracic region. Then let's see that is the structure of the intervertebral disc. So each disc it is made up from the two parts, that is the outer part it is called the annulus fibrosus and the inner part it is called the annulus pulposus. So the first part that is takes, we can see that is the annulus pulposus, or that is also called the nucleus pulposus. So the nucleus pulposus, it is the central part of the disc and it is soft and the gelatinous at the birth. It kept under the tension and act as a hydraulic shock absorber. When the age is advanced, that is the elasticity of that the disc it is much reduced. Then the peripheral, that is the annulus fibrosus. So it form the peripheral part. This is the annulus fibrosus. So it form the peripheral part of the intervertebral disc, and it is made up of the narrower outer zone. So this one, this border, that is the narrow part, that is called the outer zone of the made up from the collagenous fiber, and the wider inner zone. So this one, which is made from the fibrocartilage. The fibers from the lamina that are arranged in form of the incomplete rings. The rings are connected by the strong fibrous band. The outer collagenous fiber blend with the anterior and the posterior longitudinal ligament. So here. Then let's see that is the function of the intervertebral disc. So as you know, that is the intervertebral disc that should be present between that the two adjacent vertebra. So here in this diagram you can see this is, so it should be form or give the shape to that the vertebral column. Second one, so here that is the shape of the vertebral column, so that should be given the proper shape to that the vertebral column. Then it is act as a shock absorber or the act as a buffer. Then third one, that is because of the elasticity of the intervertebral disc, they allow slight movement of the vertebral bodies on each other. Applied or the clinical anatomy related with that the intervertebral disc. So in the young adult, that is disc is very much strong, you know. However, after the second decade of the life, that is the degenerative changes that should be occurs, and the weakness of the annulus fibrosus, means that is the peripheral layer that should be happen, and such disc it is subjected to that the strain, and the annulus fibrosus may be ruptured, and because of that should be occur the spreading of the annulus pulposus into the posterolateral side. Generally that should be occur the posterolateral side. So this spreading of that the annulus pulposus pressurized, that is the nerve root, and this condition that is called the disc prolapse. The second clinical point here you can see, that is the Annulus Pulposus that should be spread. So this is the clinical condition that is called the prolapse of the disc or the disc prolapse. So in this, that should be pressurized on the nerve root. So here that is the nerve root, and because of it can occur the pain along the course of that the nerve. So that is very commonly occurs in the sciatic nerve, so that is called the sciatica. The motor effect with the loss of power and the reflexes may follow. The disc prolapse occur most frequently into that the lower lumbar region and into that the cervical region, and it is common in the lower cervical region from 5th to 7th cervical vertebra. Then the clinical point that is related with that the vertebra. So the failure of the fusion of the two halls of the neural arch, so that is the right and this is the left. So failure to fusion of the two halls of the neural arch, it results that is the spina bifida, and sometimes that is the body it ossify from the two primary center, and if one center fails to develop, that is the one half of the right or the one half of the left side, it is missing, and this result the hemivertebra and the lateral blend of the vertebral column or the scoliosis. So this clinical condition that is called the spina bifida. The next clinical point related to that the cervical vertebra, that is the cervical rib. So here you can see this is the cervical rib, this one. So the cervical rib, it is the additional rib which arises from the C7 vertebra, and that is usually gets attached to the first rib near the insertion of the scalenus anterior, and this rib is more than the 5 cm long, and that time it is usually displays the brachial plexus and the subclavian artery, and the symptoms that should be occurs into this condition, that is the tingling pain along the inner border of the forearm and the hand, including the weakness, even can occur the paralysis of the muscles of the palm. So that is called the cervical rib, and that is occurs the congenital abnormality into that the patient. Then next to it, that is the intervertebral foramen. So here in this diagram you can see that is when two vertebra joins with each other, so on laterally that forming that the foramen, that is due to the inferior vertebral notch and the superior vertebral notch of the second next vertebra, so it forming that the intervertebral foramen. So the intervertebral foramen of the cervical vertebra, they are lie anterior to that the joints between the articular process. The arthritic changes in these joints, it occurs due to the tiny projection of the osteophytes. So here that is the osteophytes that should be occur, and these osteophytes pressure on anteriorly place the cervical spinal nerves and causes the pain along the course of the distribution of this nerve. Then next to it, so the next clinical point, that is the joints in the lateral part of the adjacent bodies, means in this region, that is called the Luschka joints, and the osteophytes, they are commonly occurs in the joints, and the cervical nerve, that is here, that is the roots of the cervical spinal nerves. So the cervical nerve roots laying posterolateral to the joints may get pressed and causing the pain along their distribution. So that is the very common condition that should be occurs according to age is increases or the second decade of the life. Then next point, that is the vertebral artery. So here you can see that is the vertebral artery that should be present into that the foramina transversa. So the vertebral artery coursing throughout the foramina transversa, which lies lateral to this joint. So here the osteophytes of the Luschka joints. So here that is the osteophytes that should be occurs on the lateral side. So the osteophytes occurs into that the Luschka joint may causes the distortion of the vertebral artery, this one, and it causes the vertebrobasilar insufficiency, and this may cause the vertigo and the dizziness into that the patient. Then next, that is the prolapse of the intervertebral disc. So here you can see that is the intervertebral disc, and that is the nucleus pulposus, and that is outer covering, that is called the nucleus fibrosus. So when the nucleus fibrosus is break, and the nucleus pulposus that should be spread on the root of the corresponding spinal nerve. So here you can see, so that is called the disc prolapse, intervertebral disc prolapse. So it occurs at the junction of the different curvature, and it is a common site is lower cervical and the upper lumbar vertebra. And the cervical region, this disc is involved above or below to the 6 cervical vertebra, and the nerve roots affected the C6 and the C7 spinal nerves, and there is occurs the pain and the numbness along the lateral side of the forearm and the hand, and there may be wasting of the muscles of the thinner eminence. Then next point, that is during the judicial hanging. So that is the hanging cases, that is the odontoid process of the axis vertebra. So this is the odontoid process that usually breaks to hit upon the vital centers which is present into that the medulla oblongata. You know, on the medulla oblongata the two major centers are present, that is the cardiac center and the respiratory center. So because of the breaking of that the odontoid process, these centers are injured, and because of that the suddenly stop the function of the organ, that is the cardiac organ function and the respiration organ function done by the lung, and because of the sudden death of the patient that should be occurs. Next to it, that is this is the atlas vertebra. So you know that the atlas vertebra, it is joins with the occipital bone to form the atlanto-occipital joint, but in the abnormal condition, when that is the atlas is fused with the occipital bone, this is called the occipitalization of the atlas, and this may times compresses the spinal cord, which require the surgical decompression. Then next to it, that is the pharyngeal and the retropharyngeal inflammation. So here that is the pharynx are present, and posterior to it, that is the cervical vertebra are present. So the pharyngeal and the retropharyngeal inflammation, it may causes the decalcification of the atlas vertebra, and this may lead to losing of the attachment of the transverse ligament, which may eventually yield, causing the sudden death from the dislocation of the dens. So these are the clinical points related with that the vertebra. So now we should have to see, that is the clinical point related with that the lumbar vertebra. So into that the lumbar region, that is a common site of the number of developmental deformities, and it causes the symptom ranging from the simple backache to the serious paralytic manifestation. So the first clinical point that is related with that the lumbar vertebra, it is called the sacralization of the fifth lumbar vertebra. So here you can see that is the fifth lumbar vertebra, and here that is the sacrum. So the fifth lumbar vertebra or its transverse process, it may be fused on one or the both side with that the sacrum, and sometimes that the transverse process may be articulate with the ala of the sacrum. So here that is called the ala of sacrum, and this may pressure on the fifth lumbar nerve. So this one. Then next to it, that is called the spina bifida. So you know that is the spina bifida, that is the two halls here, that is the two halls of the neural arch. So that is the right neural arch, this one, and that is the left neural arch. So that is the two halls of the neural arch may fail to fuse and leaving a gap in the midline. This is called the spina bifida, and meninges and the spinal cord may be herniated throughout this gap. So for this we should have to see, that is this another diagram. So this one. So the protrusion of the meninges alone result in the formation of that the cystic swelling. So this one, that is the spina bifida condition, this one, and that is the swelling, cystic swelling field on that out of that the back, and it is filled with the cerebrospinal fluid. This swelling it is called the meningocele. When the spinal cord it also present in that the swelling, this condition it is called the meningomyocele. So here in this condition, that is the spinal cord that should be also protrude out. So that is called the meningomyocele. Then next to it, that is the clinical point related with that the lumbar vertebra, that is called the Spondylolysis. So this one. So the sometimes that is the greater part of the fifth lumbar vertebra. So here that is the fifth lumbar vertebra, it slips forward over that the sacrum. So this one. So this clinical condition it is called the Spondylolysis. Then this Spondylolysis may be cause of the backache and the pain radiating along the course of the sciatic nerve. So that is called this clinical condition, that is called the sciatica. Then the next clinical point, that is the fracture or the dislocation of the lumbar vertebra, it results, that is the cauda equina syndrome, and in the cauda equina syndrome that occurs the symptoms, that is the flaccid paraplegia, the saddle shape area of anesthesia and the analgesia, and the sphincter disturbance in form of the incontinence of the urine and the feces. So this symptom group of symptoms, that is called the cauda equina syndrome. Then next to it, that is the spine of the thoracic vertebra, it may point to one side or it may be turn on the one side. So this clinical condition it is called the scoliosis. So for this here you can see, that is the scoliosis, this one, that is the spine of the thoracic vertebra, this one, it should be turned on the one side in this condition, and this condition it is called the scoliosis. Then into that the next condition here, that is called the kyphosis. So in the kyphosis there may be projection of the spines posteriorly due to the osteoporosis of the bodies of the vertebra, and this clinical condition it is called the kyphosis, this one. And next to it, the next clinical condition it is called the lordosis. So this one. So anterior convexity of the lumbar vertebra may get exaggerated and leading to that the clinical condition it is called the lordosis. So this one. So these are the clinical points related with that the vertebra.